Welcome back to Boot Diabetics, your go-to source for real, evidence-based strategies to take control of your health. If you or someone you love has diabetes, you need to hear these facts. Some of them will surprise you, some might scare you, but all of them could save your life. I remember a friend of mine who had no symptoms, but was feeling a little tired lately. He decided to get tested, just in case, and the results shocked him. His blood sugar levels were dangerously high, but he had no idea. If he hadn't asked the right questions, he wouldn't have caught it in time. That's why this video is so important. I'm also giving you 20 powerful questions to ask your doctor, so you can take charge of your health and not get caught off guard. Stick around until the end for the #1 question you must ask at your next doctor's visit. Let's get started. Diabetes basics and diagnosis. Fact 1. Type 2. Diabetes doesn't always have symptoms until it's advanced. Explanation. Many people with type 2 diabetes have no noticeable symptoms in the early stages. This is because blood sugar levels rise gradually, and the body slowly adapts to high glucose levels. By the time symptoms like fatigue, excessive thirst, or frequent urination appear, significant damage may already be happening inside the body. Ask your doctor, what are the early warning signs of diabetes I should watch for? Fact 2. Your A1C test doesn't show daily blood sugar spikes. It's just an average. Explanation. The A1C test provides an average blood sugar level over the past 2 to 3 months, but it does not capture daily highs and lows. This means someone could have dangerously high blood sugar levels at certain times of the day without it being reflected in their A1C results. Regular daily monitoring can help identify patterns and prevent sudden spikes or drops in blood sugar. Ask your doctor, should I also track my blood sugar throughout the day? And what's the best way to do that? Fact 3. Some people diagnosed with type 2 diabetes actually have type 1 LADA. Explanation. Latent autoimmune diabetes in adults, LADA, is a slow-progressing form of type 1 diabetes that is often mistaken for type 2. Unlike typical type 2 diabetes, LADA is caused by an autoimmune reaction that gradually destroys insulin-producing cells. If someone isn't responding well to standard type 2 treatments, they may need additional tests to confirm if they actually have LADA. Ask your doctor, are there advanced tests to confirm what type of diabetes I have? Fact 4. Prediabetes can be reversed, but only if you act fast. Explanation. Prediabetes is a warning sign that your blood sugar levels are higher than normal, but not yet high enough to be classified as diabetes. With early intervention, such as diet changes, exercise, and weight loss, many people can bring their blood sugar back to a healthy range. However, if left unmanaged, prediabetes often progresses to full-blown type 2 diabetes within a few years. Ask your doctor, what immediate changes should I make if I'm pre-diabetic? Fact 5. Diabetes affects more than just blood sugar. It can damage your heart, kidneys, and nerves. Explanation. High blood sugar levels over time can lead to complications in major organs, including the heart, kidneys, and nervous system. Diabetes increases the risk of heart disease, kidney failure, and nerve damage, which can cause pain, numbness, and even amputations. Regular checkups and early intervention are essential to minimize these risks. Ask your doctor, what other tests should I get to check for diabetes complications? Fact 6. Carbs, not just sugar, spike blood sugar the most. Explanation. While sugar is often blamed for raising blood glucose, carbohydrates, especially refined ones, have the biggest impact. White bread, pasta, and processed snacks can cause rapid blood sugar spikes, making it harder to manage diabetes. Opting for whole grains, fiber-rich foods, and portion control can help stabilize levels. Ask your doctor, what are the best low glycemic carbs for me? Fact 7. Skipping meals can cause blood sugar crashes and increase diabetes risk. Explanation. Many people think skipping meals helps with weight loss, but for diabetics, it can cause dangerous blood sugar fluctuations. When the body goes too long without food, blood sugar can drop too low, leading to dizziness, irritability, and even fainting. Eating balanced meals at regular intervals helps maintain stability. Ask your doctor, how often should I eat to keep my blood sugar stable? Fact 8. Some healthy foods, like fruit juices and granola bars, can secretly raise blood sugar. Explanation. Many packaged foods labeled as healthy contain hidden sugars and high-carb content. Even natural fruit juices lack fiber and cause rapid glucose spikes, just like soda. Always check labels and opt for whole fruits instead of juice. Ask your doctor, what foods should I completely avoid, even if they seem healthy? Fact 9. Intermittent fasting works for some diabetics, but it's not for everyone. Explanation. While intermittent fasting has been shown to improve insulin sensitivity in some cases, it can also lead to blood sugar imbalances for diabetics. The effects vary based on medication use, lifestyle, and metabolic health. It's important to consult with a doctor before trying fasting. Ask your doctor, is intermittent fasting safe for my condition? Fact 10. Hydration is key. Dehydration can raise blood sugar levels. Explanation. When dehydrated, the body produces more glucose, leading to higher blood sugar levels. Drinking plenty of water helps the kidneys flush excess sugar from the bloodstream. Aim for at least 8 cups a day, or more if you exercise frequently. Ask your doctor, how much water should I drink daily to maintain good blood sugar control? Fact 11. Metformin is the most prescribed diabetes drug, but it's not the only option. Explanation. Metformin is often the first-line medication for type 2 diabetes because it helps lower blood sugar and improves insulin sensitivity. However, newer medications like SGLT2 inhibitors and GLP-1 receptor agonists have been shown to help with weight loss and cardiovascular health. Depending on your health condition, your doctor might recommend an alternative or combination therapy. Ask your doctor, are there alternative medications that might work better for me? Fact 12. New treatments like GLP-1 medications help with weight loss and blood sugar control. Explanation. GLP-1 receptor agonists, such as Ozempic and Trulicity, work by stimulating insulin production and slowing digestion. These medications have gained popularity due to their ability to help patients lose weight while improving blood sugar control. Studies show that they can also reduce the risk of heart disease, making them a strong option for certain diabetic patients. Ask your doctor, would newer diabetes medications be a better option for me? Fact 13. Some natural supplements, like Berberine, have been shown to help manage blood sugar. Explanation. Berberine, a plant-derived compound, has been found in studies to be as effective as metformin in lowering blood sugar. It works by improving insulin sensitivity and reducing glucose production in the liver. However, natural supplements should always be used under medical supervision to ensure safety and effectiveness. Ask your doctor, are there any science-backed natural supplements I can take? Fact 14. Exercise can lower blood sugar for up to 48 hours. Explanation. Physical activity helps muscles absorb glucose from the bloodstream, effectively lowering blood sugar levels. This effect can last for up to 2 days after exercise, which is why regular movement is key in diabetes management. Activities like walking, strength training, and swimming have been proven to improve blood sugar control. Ask your doctor, what's the best type of exercise for me? Fact 15. Chronic stress can raise blood sugar levels, even without eating. Explanation. When stressed, the body releases cortisol and adrenaline, which can increase glucose production and make insulin less effective. Over time, chronic stress can lead to sustained high blood sugar levels and worsen diabetes symptoms. Stress management techniques such as deep breathing, yoga, and meditation can help regulate these hormonal effects. Ask your doctor, what stress management techniques can help lower my blood sugar? Prevention and long-term management. Fact 16. Type 2. Diabetes can go into remission with the right lifestyle changes. Explanation. Research has shown that significant weight loss through diet and exercise can lead to long-term remission in type 2 diabetes patients. By reducing excess fat around the pancreas and liver, insulin function can be restored, allowing the body to maintain healthy blood sugar levels naturally. However, remission requires ongoing lifestyle management to prevent relapse. Ask your doctor, what steps can I take to put my diabetes into remission? Fact 17. Getting less than 6 hours of sleep can increase your risk of diabetes. Explanation. Poor sleep quality and insufficient rest can disrupt insulin sensitivity and increase the risk of high blood sugar levels. Studies have linked chronic sleep deprivation to a greater likelihood of developing type 2 diabetes, even in otherwise healthy individuals. Establishing a consistent sleep schedule and reducing screen time before bed can help improve sleep patterns. Ask your doctor. How does sleep affect my diabetes, and how can I improve my rest? Fact 18. Even thin people can develop type 2 diabetes. It's not just about weight. Explanation. While obesity is a major risk factor for diabetes, genetic predisposition, inactivity, and poor diet can also contribute to insulin resistance. Thin individuals with a high percentage of visceral fat, fat stored around internal organs, are particularly at risk. This highlights the importance of regular checkups and healthy lifestyle habits, regardless of body weight. Ask your doctor, what are the biggest risk factors for someone of my weight? Fact 19. Early intervention is the key to preventing complications. Explanation. Detecting diabetes early allows for immediate lifestyle changes that can prevent irreversible complications such as nerve damage and kidney disease. Many people don't realize they have diabetes until symptoms become severe, so routine screenings are crucial. The earlier diabetes is managed, the better the long-term outcomes. Ask your doctor, what should be my top priority today to stay healthy long-term? Fact 20. The #1 way to prevent diabetes complications is regular checkups. Explanation. Seeing a healthcare provider regularly ensures that blood sugar levels, cholesterol, blood pressure, and other vital markers are monitored. Regular screenings allow for early detection of complications before they become serious. Preventative care, combined with a healthy lifestyle, is the best strategy for maintaining long-term health with diabetes. Ask your doctor, how often should I come in for diabetes screenings? Now that you know these 20 shocking diabetes facts, what will you do differently? Drop a comment below with the fact that surprised you the most. Diabetes, a word that resonates with millions worldwide. It's a condition as ancient as it is modern, affecting lives from the days of ancient Egypt to the high-tech era of continuous glucose monitors. Today, we journey through time to uncover the fascinating history of diabetes, exploring how our understanding and management of this condition have evolved over centuries. Ancient references to diabetes. A. Early observations in ancient cultures. Our story begins over 3,500 years ago in ancient Egypt, where the earliest known reference to diabetes appeared in the Ebers Papyrus. Physicians described a mysterious condition marked by too great emptying of the urine. Little did they know, this was one of the earliest observations of diabetes. Around the 6th century BC, ancient Indian physicians documented madhumeha, meaning honey urine. They noted how ants were attracted to the sweet urine of individuals with this condition. Ayurveda recommended natural treatments like a balanced diet, physical activity, and herbal remedies, principles still relevant today. In China, diabetes was known as xiaoke, or wasting-thirsting disease. Traditional Chinese medicine employed herbal formulas and acupuncture to manage symptoms, showcasing early integrative approaches to health. The Greeks and Romans also took note of this illness. Greek physician Aretaeus of Cappadocia, in the 2nd century AD, coined the term diabetes, meaning siphon, to describe how the body seemed to pass fluids through like a funnel. Unfortunately, treatments remained elusive until much later. Case studies. Early diabetes management. Case study 1. Traditional treatments in ancient India. Ancient Indian physicians treated diabetes with dietary control, herbal mixtures, and physical exercise. Historical texts mention how patients who adhered to these regimens had better health outcomes, a principle that echoes in modern diabetes management. Case Study 2. Early Chinese Medicine Techniques. Chinese practitioners focused on balancing the body's qi through herbs and acupuncture. One documented case involved a patient who managed symptoms effectively by combining diet, exercise, and acupuncture, showcasing an early holistic approach. Global impact of diabetes. A. The economic and social costs. Diabetes affects over 400 million people worldwide. The economic burden includes healthcare costs, lost productivity, and the impact on families. Countries like the USA, India, and China have implemented national strategies to address the diabetes epidemic. B. Healthcare system strain. Hospitals and clinics are increasingly focused on managing diabetes and its complications. From specialized diabetes centers to public health initiatives, the fight against diabetes is a priority globally. C. Education and prevention programs. Public health campaigns like the Know Your Numbers initiative encourage regular blood glucose testing and healthy lifestyle choices. Such programs have proven effective in reducing the incidence of diabetes-related complications. Practical applications. Modern management of diabetes. A. Advances in medication and technology. Today, managing diabetes involves more than just insulin. Medications like Metformin, SGLT2 inhibitors, and GLP-1 receptor agonists offer more tailored treatments. Technologies like continuous glucose monitors, CGMs, and insulin pumps have revolutionized care. B. Nutrition and lifestyle management. Modern nutrition science emphasizes the role of a balanced diet and physical activity in managing diabetes. Programs like the DASH diet and carb counting help individuals maintain stable blood sugar levels. C. Future innovations. Hope for a cure. Research into stem cell therapy, beta cell transplants, and artificial pancreas systems offers hope for the future. Scientists are working on treatments that could one day make diabetes a thing of the past. From ancient texts to advanced technology, the history of diabetes research is a story of progress and perseverance. While challenges remain, the future is bright with possibilities for a cure. At Boot Diabetics, we are dedicated to supporting everyone on their journey to better health. For more insights, expert tips, and diabetes-friendly resources, visit www.bootdiabetics.com. Together, let's continue the journey toward better health and a brighter future. Artificial intelligence, or AI, is not just a buzzword. It's revolutionizing healthcare, including diabetes management. From predictive analytics to personalized treatment plans, AI offers new hope for millions of diabetics worldwide. Today, we explore how AI is transforming diabetes care and what the future might hold. Current applications of AI in diabetes management. A. Predictive analytics for early diagnosis. AI-powered algorithms analyze vast amounts of patient data to predict the likelihood of developing diabetes. By identifying patterns and risk factors early, AI helps healthcare providers initiate preventive measures before symptoms appear. B. Personalized treatment plans. AI technologies like continuous glucose monitors, CGMs, and smart insulin pens provide real-time data that allow personalized treatment. These tools integrate with apps to adjust medication, recommend dietary changes, and even predict blood sugar fluctuations. C. Enhanced diabetes education and support. AI-driven platforms offer 24/7 support through chatbots and virtual assistants. These tools answer questions, provide reminders for medication, and offer educational resources tailored to each patient's needs. D. Remote monitoring and telemedicine. For those with diabetes, regular monitoring is crucial. AI-powered wearables and telemedicine platforms enable doctors to monitor patients remotely, ensuring timely interventions without the need for frequent clinic visits. Case studies, success stories with AI. Case Study 1, Google's DeepMind and Early Detection. Google's DeepMind uses AI to detect early signs of diabetic retinopathy by analyzing retinal scans. This breakthrough has helped prevent vision loss in many diabetic patients by facilitating early treatment. Case Study 2. The impact of AI in insulin management. Companies like Medtronic have developed AI-powered insulin pumps that predict blood sugar drops and adjust insulin delivery automatically. These smart devices reduce the risk of hypoglycemia and improve the quality of life for type 1 diabetics. Future predictions. The role of AI in shaping diabetes care. A. Towards a cure, AI and medical research. AI is accelerating research into diabetes treatments and potential cures. Machine learning models analyze genetic data to identify new drug targets and streamline clinical trials, bringing life-saving therapies to market faster. B. Precision medicine and personalized therapies. In the future, AI could analyze individual genetic makeup and lifestyle data to create highly personalized treatment plans. This precision medicine approach could help manage or even reverse type 2 diabetes through targeted interventions. C. Smart homes and daily diabetes management. Imagine a home where your refrigerator suggests diabetes-friendly meals, or your wearable device alerts you to take a break and exercise. AI could seamlessly integrate diabetes management into everyday life, making healthy choices effortless. 10 inspiring diabetes success stories, real-life case studies. 1. Sarah's journey with smart insulin pens. Sarah, a type 1 diabetic, struggled with managing her blood sugar levels until she started using an AI-powered smart insulin pen. The device helped her predict glucose trends, significantly reducing her risk of hypoglycemia. 2. John's transformation with continuous glucose monitors. John experienced frequent blood sugar spikes. With a CGM, he received real-time alerts and learned how specific foods affected his glucose, leading to better diet choices and overall stability. 3. Maria's newfound freedom with an artificial pancreas system. Diagnosed with type 1 diabetes as a child, Maria gained independence through an artificial pancreas. The AI technology automatically adjusted insulin levels, giving her peace of mind, especially during sleep. 4. Tom's success with AI diet coaching. Tom, a type 2 diabetic, used an AI-driven diet app that analyzed his intake and provided personalized meal suggestions. His HbA1c levels improved dramatically within a few months. 5. Elena's predictive analytics experience. Elena used a program with AI to predict the likelihood of diabetes-related complications. The insights helped her and her doctor develop a proactive health plan, avoiding potential health crises. 6. Paul's safety through remote monitoring. Through AI-based remote monitoring, Paul's healthcare team identified early signs of diabetic ketoacidosis. Timely intervention prevented a potentially life-threatening situation. 7. Community impact in rural India. An initiative in rural India used AI tools to screen for diabetes. Early detection and education significantly reduced health issues, showcasing how technology can reach underserved populations. 8. Lisa's smart home integration success. Lisa connected her diabetes management tools with her smart home system. AI-driven reminders for medication, exercise, and meals helped her maintain a healthy routine seamlessly. 9. Michael's breakthrough with machine learning insights. Machine learning tools helped Michael identify lifestyle patterns affecting his blood sugar. Adjusting his habits led to remarkable improvements in his overall health. The psychology of dealing with diabetes, emotional well-being, and coping strategies. Understanding the emotional impact of diabetes. Living with diabetes involves more than just managing blood sugar levels. It also brings a range of emotional and psychological challenges. From the initial shock of diagnosis to the ongoing stress of daily management, diabetics often experience feelings of anxiety, depression, and burnout. Understanding these emotions is the first step toward building resilience. Common psychological challenges faced by diabetics. Diabetes distress. A specific emotional response to living with diabetes, characterized by feeling overwhelmed by the demands of managing the disease. Anxiety and fear, concerns about potential complications, hypoglycemia, or managing diabetes in public settings. Depression. People with diabetes are more likely to experience depression, which can interfere with self-care and disease management. Burnout. A state of exhaustion from the relentless nature of diabetes management, leading to neglect of blood sugar monitoring or treatment regimens. Effective coping strategies for mental well-being. Mindfulness and stress management. Practices such as meditation, deep breathing exercises, and yoga can reduce stress and improve mental clarity. Establishing a routine. Consistent daily routines for meals, medication, and exercise can reduce uncertainty and promote stability. Setting realistic goals. Instead of striving for perfection, focus on achievable health and lifestyle goals. Building a support network. Engaging with support groups, whether in person or online, can provide comfort and practical advice from others who understand the diabetes journey. Seeking professional help. Therapists and counselors, particularly those specializing in chronic illness, can help diabetics navigate complex emotions and develop healthier coping mechanisms. The role of AI in supporting mental health. AI technology is increasingly playing a role in mental health support for diabetics. Apps offer features such as guided meditation, helping manage stress and anxiety, mood tracking, monitoring emotional patterns and offering insights, virtual support groups, connecting diabetics with communities where they can share experiences and encouragement. Practical tips for maintaining emotional balance. Celebrate small wins. Recognize and reward yourself for managing your diabetes. Even small achievements matter. Educate yourself. Knowledge about diabetes management can reduce fear and increase confidence. Stay active. Physical exercise is not only good for blood sugar control, but also boosts mental health by releasing endorphins. Stay connected. Regular social interactions, whether with family, friends, or support groups, reduce feelings of isolation. While diabetes presents ongoing challenges, focusing on mental health is crucial for overall well-being. With the right tools, strategies, and support, living a full and vibrant life with diabetes is not only possible but entirely achievable. At Boot Diabetics, we are committed to providing resources and support to help manage both the physical and emotional aspects of diabetes. How to help aid someone with diabetes. Practical tips, supportive strategies, and real-life case studies. Introduction: Why support matters. Supporting someone with diabetes involves more than just understanding their medical condition. It requires empathy, patience, and a willingness to help with both physical and emotional aspects of managing this chronic illness. Whether you are a family member, friend, or caregiver, your support can make a significant difference in their quality of life. 1. Educate yourself about diabetes. Learn the basics. Before offering support, it is crucial to have a solid understanding of diabetes, including the different types, symptoms, and treatment approaches. Type 1. Diabetes, an autoimmune condition where the body attacks insulin-producing cells in the pancreas. Individuals with type 1 need insulin therapy for life. Type 2, diabetes, a metabolic disorder where the body becomes resistant to insulin or doesn't produce enough. It can often be managed with lifestyle changes, oral medications, and sometimes insulin. Gestational diabetes occurs during pregnancy and usually resolves after childbirth, but may increase the risk of developing type 2 diabetes later in life. Stay informed. Research regularly. Follow reputable sources such as the American Diabetes Association, National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, and Boot Diabetics. Understand blood sugar management. Learn how diet, exercise, medication, and monitoring play roles in maintaining healthy blood sugar levels. Familiarize with devices. Understand how tools like blood glucose meters, continuous glucose monitors, CGMs, and insulin pumps work. Second, assist with daily management. Help with routine tasks. Supporting daily management involves both practical help and gentle reminders to stay on track with their diabetes care plan. Meal preparation. Cook balanced, diabetes-friendly meals with a focus on low glycemic foods, whole grains, lean proteins, and healthy fats. Exercise encouragement. Engage in activities together, such as walking, cycling, or joining a fitness class to make physical activity enjoyable and less of a chore. Medication management. Help organize medications, whether through a pill organizer, setting up reminders on a phone, or using an app designed for chronic illness management. Be prepared for emergencies. Recognize warning signs. Learn the symptoms of hypoglycemia, shakiness, sweating, confusion, and hyperglycemia, frequent urination, increased thirst, fatigue. Know what to do. Carry emergency supplies like glucose tablets, snacks, or an emergency glucagon kit, and know how to use them if needed. Create an emergency plan. Have clear steps for what to do in case of a diabetic emergency, including contacting their healthcare provider or emergency services if needed. Case study, supporting daily management. Emily, a college student with type 1 diabetes, struggled to maintain a balanced routine between her studies and diabetes management. Her roommate Sarah helped by preparing healthy meals and setting reminders for Emily to check her blood sugar. Sarah's support significantly reduced Emily's stress, allowing her to focus better on her studies. 3. Provide emotional support. Be a good listener. Living with diabetes can be emotionally taxing. Listening and offering a non-judgmental space for them to express their feelings is invaluable. Acknowledge their feelings. Validate their emotions, whether they feel frustrated, tired, or anxious about their health. Encourage expression. Ask open-ended questions like, "How are you feeling about your diabetes management lately?" Support mental health. Encourage professional help. Suggest talking to a therapist, especially those who specialize in chronic illness. Engage in relaxing activities. Activities like yoga, meditation, or hobbies can help manage stress and improve mental health. Promote a positive mindset. Remind them of their successes and progress, even if they seem small. Book case study, emotional support. Michael, a father of 2, often felt overwhelmed managing his type 2 diabetes. His wife encouraged him to join a support group, where he found solace in sharing his experiences and learning from others. This sense of community improved his outlook and motivation to manage his health effectively. 4. Promote a healthy lifestyle. Make healthy choices together. Collaborative meal planning. Work together to create meal plans that are not only healthy but also enjoyable and sustainable. Active living. Join them in physical activities, making exercise a shared and enjoyable part of the day. Create a positive environment. Avoid temptations. Keep sugary and unhealthy foods out of shared spaces, or offer healthier alternatives. Celebrate healthy choices. Reinforce positive behaviors, like choosing water over soda or preparing a healthy snack instead of grabbing fast food. 5. Respect their independence. Offer help, but don't overdo it. Balance assistance and autonomy. Support their efforts without taking over their diabetes management. Encourage them to handle tasks independently, offering help only when needed. Respect their decisions. Everyone manages their health differently. Instead of insisting on your approach, ask them how they prefer to manage their care and support those choices. Book case study. Encouraging independence. Linda, whose teenage son Mark was recently diagnosed with diabetes, found it difficult not to take over his care. However, by gradually giving Mark more responsibility and trusting him to manage his condition, she noticed a boost in his confidence and better management of his health. Conclusion: the power of support in diabetes care. Supporting someone with diabetes involves understanding, patience, and a proactive approach. Your role as a friend, family member, or caregiver can significantly impact their physical and emotional well-being. By offering practical help, emotional support, and promoting independence, you empower them to live a healthy, balanced life. I used to think sugar was harmless, until I quit for 30 days. The first week? Brutal. But by the end, my energy skyrocketed, my skin cleared up, and the cravings were gone. Stick around because I'll show you exactly what happens to your body when you stop eating sugar. And trust me, week 4 is a game changer. Welcome back to Boot Diabetics, your go-to channel for expert diabetes and health tips. In this video, we're diving deep into what happens to your body when you cut out sugar for 30 days, step by step. Make sure to watch until the end because I'll also share the #1 most unexpected benefit people experience when quitting sugar. Week by week breakdown. What happens when you quit sugar? Week 1. Withdrawal and cravings. Hit hard. What happens? Your body goes through withdrawal. Yes, sugar is addictive. Cravings for sweet foods spike as your brain craves dopamine. You might feel irritable, sluggish, or even have headaches. In the first few days, your body goes into full detox mode. Sugar activates the brain's reward system just like drugs do. So when you cut it out, withdrawal symptoms hit hard. The best way to fight cravings? Load up on protein, healthy fats, and fiber. Mark, a diabetic patient, almost gave up on day 3 because of the cravings. But by drinking more water and eating more protein, he powered through, and in just 2 weeks, he had stable blood sugar for the first time in years. Week 2. Energy levels improve and cravings decrease. What happens? Blood sugar stabilizes, meaning no more energy crashes. Your cravings start to subside, making it easier to resist sugar. Many people feel lighter and less bloated as inflammation decreases. By week 2, you start feeling the real benefits. No more sugar crashes, no more insane cravings. Your body is adjusting to burning fat instead of sugar, which helps regulate blood sugar and energy. You might even drop a few pounds without changing anything else. Partigam. What to eat instead? Instead of soda, try sparkling water with lemon. Instead of candy, eat berries or dark chocolate, 85% plus cacao. Instead of breakfast cereal, go for oatmeal with cinnamon. Week 3. Major health improvements kick in. What happens? Skin starts looking clearer and brighter due to reduced inflammation, better digestion and less bloating as gut health improves, deeper sleep and improved mental clarity due to stabilized glucose levels. Week 3 is when the magic really starts to happen. Your skin looks brighter, digestion feels smoother, and your brain fog starts lifting. This is proof that sugar was wreaking havoc on your health more than you even realized. On-screen visual. Before and after comparison of someone's skin and energy levels. Real-life success story. Lisa had suffered from brain fog for years, but after quitting sugar for 3 weeks, she finally felt mentally sharp again. She even started reading books faster. Week 4. Long-term metabolic benefits and fat loss. What happens? Your metabolism adjusts to burning fat for energy. Insulin sensitivity improves, meaning better blood sugar control. Many people experience weight loss and improved mental focus. By week 4, your body has fully adapted to a lower sugar lifestyle. Your metabolism speeds up, you may have lost some fat, and your risk for diabetes and heart disease has decreased significantly. Best of all, you feel more in control of your cravings and energy. On-screen visual. A healthy, energized person smiling next to day 30 success. Final takeaways. Is quitting sugar worth it? So, was quitting sugar worth it? Based on what we've seen, yes. From improved energy, weight loss, better sleep, and glowing skin, the benefits are undeniable. On-screen prompt. Would you try quitting sugar for 30 days? Comment yes or no below. Mini challenge to boost engagement. I challenge you to quit sugar for just 1 week. Comment below, I'm in, and I'll check in with you. Let's do this together. If you found this video helpful, make sure to hit like and subscribe for more expert health and diabetes tips. And if you want a free 7-day sugar detox plan, head to www.bootdiabetics.com to download it now. Trust me, you'll thank yourself later. See you in the next video.